And actually, the highest risk neighborhoods are receiving the lowest amount of vaccine.
We are only a few days into Doug Ford's so-called shutdown here in Ontario over the pandemic, and it's been so disastrous that he's already saying that stricter measures are coming. Now, in this video, I'm going to break down for you some of the data, the news, maybe make you laugh with somebody else's comedy, and near the end of this video, I will show you a an interview with a doctor where he just completely dismantles Doug Ford's response so far to this pandemic. Now, before I get to that, let me show you here the data. So right now, Ontario is seeing about 3,000 new cases a day. You see here, we are well into the third wave, and this is largely driven by the variants of concern, which spread easier, are more deadly. In fact, according to data here, your risk of ending up in the ICU with these new variants is over 100% higher than before, and your risk of dying is over 40% higher. So understand, this is very much a different pandemic. More deadly, more contagious. Now, the response so far to this had been to shut down the province. So on April 3rd, Ontario went into a shutdown to control the spread, recommending people stay home, don't meet with others indoors. Also, capacity is limited in retail stores to 50% for those deemed essential and 25% for non-essential retailers, while restaurants are restricted to takeout, delivery, and drive-through service. And as I said, we're only 3 days in, and already, because of the way this wave is coming, stricter public health measures are supposedly on the way, according to Doug Ford. Now, before I get to some other stuff here, I got to show you this. So this is the first day of the shutdown. This account here tweeted out, "Live today from Yorkdale Mall on the first day of our shutdown while all small business remains closed. Once again, Ford Nation Doug Ford has failed the people of Ontario." So this is, just check this out as I talk over it here. Yorkdale Mall, a very popular mall here in Ontario, and just packed. Absolutely packed. You have a mall like this open while destroying small businesses. Small businesses that have, very small footprint, not many people, or in terms of capacity, very few are able to physically be inside of a small business, a small retailer. But you have here big box retailers, malls like this, having crowds of people. You see that the parking lot is just completely insane. This was turned into some satire here by the Beaverton with their headline, "Doug Ford clarifies Yorkdale Mall still open for essential Versace, Bulgari, and Fendi supplies." Hilarious. Just incredible that you have malls open, crowds of people, but small business being destroyed. Meanwhile, people buying their handbags in a giant mall and also going to big box retailers. Now, this is another aspect of the absurdity of the shutdown. Ontario's coronavirus emergency break rules ban online streaming of concerts. You apparently can't stream your concert online, which oftentimes doesn't really require that much of a crew. Really only need one camera. Big venues. But no, can't do that. But if you want a handbag at a Yorkdale Mall, well, don't worry. Go and visit the crowd of people and go buy your handbag. Very, very ridiculous shutdown we have here. Now, Patty Haidu here tweeted out, "As of today, we have delivered 10 million COVID-19 vaccines across Canada. Here's how we're working with provinces and territories to protect communities." 10 million, which is actually not horrible. It's about 26% of the population of Canada. Yet, in terms of what has been administered, we're nowhere near that. So while we have enough vaccines for 26% of the country, we've only vaccinated about 11%. So numbers right here, 11.91%. So more than half the supply right now sitting in fridges. And Ontario specifically, we've had over 4 million vaccines delivered and have only administered about 2.5 doses. So 2.5 million doses administered, 4 million delivered. showing you that this isn't just the fault of the Canadian government, of the Trudeau government. Yes, we should have more. We should also have our own producer of these vaccines. We used to have our own producer back in the 80s, and the Conservative government sold it off, and we never created a new one. So we had to have this patchwork system, buying all these vaccines from all these different suppliers. But the failure wasn't even just with the supply, which is getting better now, but in how it's being administered or not administered across the various provinces. And Ontario right now is one of the absolute worst. We have the vaccines and they're simply not getting into enough arms. Now, I want to show you this clip here. So, short clip here from, let me get his name, Dr. Amit Arya. So, he was on CBC and just gave a fantastic breakdown of how much of a failure this shutdown has been, and really the entire approach by the Ford government to this pandemic.
It's really odd to me that we're allowing big box retail to stay open. We have schools open, places of worship open, but yet outdoor situations like sitting on a patio where you should have 100% ventilation are closed. There were no new protections announced for schools like vaccinating teachers or improving ventilation or class sizes. And most importantly, at this point, the pandemic is bearing its brunt on essential workers, the people we've called heroes. These are the people that we're seeing suffering and dying and coming into our hospitals and overwhelming our ICUs. So there was no announcement about paid sick days, and our vaccine rollout is also a failure. I mean, we have over 500,000 doses sitting in freezers at this point in time, and actually the highest risk neighborhoods are receiving the lowest amount of vaccine. And if you're someone who doesn't see patients and you work from home on Zoom, and you're 55, versus a 30-year-old who's working on the floor of a factory and is exposed to 300 other people, takes mass transit, comes home, and lives with their parents, often in a multi-generational household in an apartment. I mean, undoubtedly, your risk would be higher. And that's actually what our modeling data showed us weeks ago here in Ontario.
So I'll link to that entire interview below. It was, I would say, enlightening, but a lot of this really is just common sense. People on the front lines that interact with the public on a daily basis, grocery store workers, teachers, are the ones that are ending up in the ICUs. Why would you not vaccinate those people in the first phase? It makes a lot more sense to vaccinate somebody who is public facing every single day, who's a grocery store worker, a teacher, someone that works in an Amazon warehouse where there've been a massive spread of COVID-19, over somebody who is 50 years old, working from home, and has very little contact with the outside world. They're just not, the Ontario government is not looking at this from a position of how to actually control the virus. They're looking at this through a political lens. They're looking at who normally votes for them, older individuals, and rolling out the vaccine that way. Now, yes, obviously, when it comes to, long-term care, obviously people in long-term care, 80 plus, 70 plus, yes, should be vaccinated, of course. I'm not saying they shouldn't be vaccinated, but you have here vaccinations sitting in fridges, and these vaccines are not being offered to people in frontline work, where you can actually control the spread by vaccinating people that interact with the public every single day. This is common sense. And at the same time, of course, Doug Ford against mandatory paid sick days. So people go to work feeling sick, and then they end up spreading it to other people. Unbelievable. Last thing here, I saw this tweet. I just want to share it. Tweeted out by Dr. Abdu Shakarwi, saying, posted with permission, 47-year-old teacher, totally healthy, COVID-19 student contact, now intubated in ICU. Explain why schools aren't safer. Explain why teachers aren't vaccinated. Explain why essential workers now fill our ICUs in Ontario. Explain. It's all right there. It's obvious. If you're going to keep schools open, the least you can do is vaccinate the people most at risk, the adults in the room. They couldn't even do that.